Hello everyone, my name is Chen and we would like to talk about Fasciola Hepatica. We are from small group discussion B8. These are all the members of B8. We would like to talk about its morphology and anatomy, its life cycle, epidemiology, pathogenic effects and symptoms, diagnosis, management, and treatment. Now we will start from the introductions first.
Hello everyone, my name is Adellya Pramesty and my name number is 22025111165. And the background is, as we know, humans live side by side with other organisms, ranging from cellular to acellular organisms. Humans not only coexist with beneficial organisms, but also coexist with pathogenic organisms. Pathogenic organisms are organisms that are detrimental or bring diseases to living things. With the meat consumption increased by 8% in the last 20 years, the risk of diseases caused by pathogens related to meat consumption was certainly increased. Few diseases related to meat consumption are caused by Fasciola hepatica. This organism is not only a parasite in livestock, but also infect humans if accidentally ingested. Therefore, further studies on Fasciola hepatica are needed as a step to study the characteristics, life cycle, epidemiology, and diseases related to this organism, so that we can recognize and avoid the risk of related diseases. And we can see below, there are our main problems, goals, and benefits in making this student project. The next part will be explained by my friend.
Hello, my name is Putu Ayudhea A and my name numbers is 22025111164. I will explain about the definitions of Fasciola hepatica. Fasciola hepatica belongs to the family Fasciolidae of the phylum Platyhelminthes, class Trematoda, subclass Dygenia, order Echinostomida, suborder Distomata, and genus Fasciola. It is a parasite that is also called the liver fluke, which causes the disease fasciolysis or liver rot in ruminants and many other mammals, including humans. Common mode of infection is by eating contaminated vegetation such as watercress. Fasciola hepatica is cosmopolitan in distribution, being found throughout all regions of the world, both temperate and tropical, and there are significant numbers of patients in Eastern Europe, Iran, Northern Africa, and South America. Next.
Hello everyone, my name is Yanti Graciella with my three-digit number is 162. For the general morphology, Fasciola hepatica has a flat body shape due to its cephalic cone, soft and tawny. It's usually in pink color but appears tawny due to the bile that it gets from its house. It has 130 until 150 micrometer for its length and 60 until 90 micrometer for its width. The anterior of Fasciola hepatica is slightly rounded, while the posterior is somewhat ballooned. You can also see the picture beside there. For the external morphology, Fasciola hepatica has a mouth that located laterally and is triangular in shape. Behind the mouth, there are also two suckling muscles that are used to absorb nutrients from its host. They are oral and ventral suckers. Oral suckers encircle the mouth and has 1 millimeter for its size. For the ventral sucker, it also called acetabulum, and it's located far away from anterior, specifically on the ventral of the body. Next.
Hello, my name is Putu Asweni Pururaswini Astawa. My NIM numbers is 2202511161. The wall of Fasciola hepatica. Fasciola hepatica doesn't have epidermis on its wall, but covered by a thick layer called cuticle that made of homogeneous scleroprotein. Body wall also contains a layer and doesn't have an anus. Next. Nerve system. It has a nerve ring that surrounds its esophagus. The nerve ring has a pair of the dorsolateral cerebral ganglia and ventral ganglia in the lower esophagus. Reproductive system of Fasciola hepatica. Fasciola hepatica is hermaphrodite. That means this worm already has two kinds of genitals in its body. Cross-fertilization. Here is fertilization that occurs between one helminth and another helminth. This can happen because Fasciola hepatica already has good and complex reproductive organs. Next.
Okay, let me introduce myself. My name is Patricia Orlyn Jotan, and the last three digits of my student number is 171. And now I'm going to explain its cycle. It's also called sheep liver loop. Fasciola hepatica is a parasite of herbivores, particularly sheep and cattle and human. Its life cycle results in human infection from digestion of watercress that harbors encysted metacercari, and for the step of transmission and the complete cycle can be seen below. The first one, unembryonic eggs are passed from humans or animal feces. Ruminants are the typical definitive host. This stage, also known as diagnostic host stage. Second one, eggs become embryonated in fresh water over 2 weeks. The third The first Sakari exists as metasaccari on aquatic vegetation or other substrates. And then the sixth one, humans and other mammals become infected by ingestion metasaccari contaminated vegetation, for example, watercress, and this is an infective stage. After ingestion, the larval flukes then migrate through the duodenal wall and across the peritoneal cavity, penetrate the liver capsule, pass through the liver parenchyma, and enter the bile ducts where they mature to become adult worms. And the last one, approximately 3
Okay, allow me to introduce myself. My name is Evrilla Deidree, and my NIM number is 2202511163. I will be explaining about the epidemiology of Fasciola hepatica. Fascioliasis is more common in animals than humans. There is a sporadic and hyperendemic in some areas, and Fasciola hepatica is found in focal areas of 70 countries in all continents except Antarctica. It is found in parts of Latin America, the Caribbean, Europe, the Middle East, Africa, Asia, and Oceanica, but it is most found in the Andean highlands of Bolivia and Peru. Infective Fasciola hepatica in the metacercaria stage are found in contaminated water stuck to water plants.
Hello, my name is Nadira with my last 3-digit number 160, and I will explain about the pathogenic effect and the symptoms. So, an infection caused by Fasciola hepatica is known as fascioliasis. Fascioliasis is also known as the common liver fluke or the sheep liver fluke. The pathology typically is most pronounced in the bile ducts and liver. The pathology of fasciolitis in humans depend on several variables, including fluke species and isolated, parasite burden, and host biology. It is mostly connected with the trauma caused by the immature flukes drilling through the liver and the intestines, which are connected to the stage of infection. The next presentation will be presented by my friend. Thank you.
Hello, my name is Michelle Putri, and my NIM number is 2202511167. So, someone who has been declared infected with Fasciola hepatica will experience two different stages. Each stage experience has quite different symptoms. In the first stage, which is the acute or invasive stage, will be the hepatic stage of the illness. The classic symptoms of this first stage can be described as follows: fever, nausea, abdominal pain, urticaria, pain in the right hypochondrium, hepatomegaly, hypergemoglobulinemia, eosinophilia, mild hepatitis, severe subcapsular hemorrhage, and frank hepatic necrosis. Next, then, the second stage is characterized by intermittent pain in the right hypochondrium with or without cholangitis or cholestasis. Plus, the symptoms of eosinophilia are the same as the first stage. Meanwhile, in children, subclinical infection can cause weight loss, anemia, and may lead to developmental delays. Next.
Greetings, my name is Herberth, and I'll be covering about the diagnosis of Fasciola Hepatica. So the most common method to diagnose the existence of Fasciola Hepatica is by examining the stool specimen. If the eggs of Fasciola Hepatica are seen in the microscopic view of stool, then a positive result can be concluded. Although there are some cases where false results were found in the stool. This condition can occur when eggs found in the stools are non-infective eggs. This is caused by the release of eggs by the body after consuming contaminated liver in the near future, in the near time or tempo. Such a misdiagnosis can be avoided and anticipated by advising the patient to go on a liver-free diet for a few days before another stool observation. Next will be covered by my friends.
Okay, greetings. My name is Zulfikar A, and I'm going to continue the talk of my friend. So, besides looking at stool specimens, the Fasciola Hepatica could also be detected by serological tests. Specifically saying, the immunoblood test can detect the reaction of immunoglobulin G reaction against FHSA-E2, which is a recombinant antigen of Fasciola Hepatica.
Okay, let me introduce myself. My name is Wildan Mahsyar. My last name number is 174. Management and treatment. Fasciola hepatica infections can cause vasculitis in humans, and patients with vasculitis can be present during acute or chronic phase of the infection. Triclopyrdazole has become the drug of choice for the treatment of acute and chronic human vasculitis recommended by World Health Organization. Triclopyrdazole is a benzimidazole drug that interferes with the parasite's beta-tubulin polymerization balance. Triclopyrdazole causes disruption of the tegumen and inhibits protein synthesis in fasciola. Recommended dose is 1 or 2 doses at 10 mg per kilogram per dose, separated 12 to 24 hours. Especially in the chronic stage of infection, nitazoxanide could be the alternative. Nitazoxanide drug is given orally with food. The dosage regimen for adults is 500 mg per oral feed twice a day for 7 days. However, there are drugs that no longer recommended for the treatment of fasciolitis. Fasciquantel, previously used as an alternative, is no longer recommended due to its poor efficacy against Fasciola species. Amethine, dihydroamethine, metronidazole, albendazole, niclovan, chloroquine, hexachloroparacetol, artesunate, and artemether are also no longer recommended due to toxicity. That's for the management and treatment. Thank you.
I would like to introduce myself again. My name is Cendrawan Han Santoso. With my number is 2202511170. Now, in conclusion, Fasciola hepatica is a hermaphrodite trematode that causes fasciolitis worldwide. These worms are usually found in the intestines of livestock, but it can also infect humans too. Humans are usually infected with fasciolitis by ingesting food and water that are contaminated with Cercaria. Larvae in the human intestines develop for 3 to 4 months into adult worms. Symptoms that usually arise are fever, nausea, abdominal pain, and eosinophilia. After Fasciola hepatica becomes an adult worm, it will produce eggs, and these eggs are released through the feces or located in the perianal region. Therefore, to diagnose this parasite, observation of the feces are of importance. It is also known that when you are infected, the choice of drugs is triclabendazole and nitazoxanide. Even though these drugs are available for treatment of this parasite, we must also prevent the growth of this disease by maintaining food hygiene and properly cooking food. This is all about Fasciola hepatica. Thank you.